Well, this says to submit any questions, but I think we can just, you know what you can do, is you can repeat the question.
Yep.
Because we didn't do that yesterday. We had them written
And I read them on the speakers so
yeah,
they
but
could hear.
what was the other session that we were doing?
Oh, I wasn't up front, but you did fine. I went to the one about racing, and...
That was it. Yeah, we didn't repeat the questions.
No, well, I could hear them.
Yeah, but the microphones probably didn't pick it up. But anyhow,
Yeah.
I forgot all about it at the end of that. I said, oh, I hope people heard. Because it is annoying when you're watching a videotape, you're like,
Oh, yeah.
what do they say? So
I
yeah, if
know.
you could repeat the question, we don't need to write them down, I think.
Okay.
That'd be fine.
Yep,
We'll just
have to.
make sure we get a fair.
yep.
Good morning. I'm always late for things, so I like to start just a few minutes late to give me a chance to get here. Exactly. There's got to be some other people out there, but this is a prompt group, actually, isn't it? No, it is. It is such a nice group. I called down to give a compliment to the manager about one of his employees, and he was appreciative of that. But he turned around and he said, "We are just loving having this group. They are such a great group of people." And I mean, he wasn't just saying, there's people who could just say that, but no, he was really genuinely impressed and just really enjoyed having everybody. So I'm sure there's some other groups that they might not be able to say the same thing.
I think it reflects on PHI well that they most likely set up everything so well with them.
Yeah, I think he was talking more just interpersonally, just, talking to people and things like that. I mean, there's, when you treat everybody with respect and engage people and things like that, you kind of lose track of the fact that there's a good number of people out there who don't do that. And so but those aren't the folks who come to these meetings. Mm-hmm. Yeah.
And it's an education.
Yeah, that's
some of their prejudices.
Yeah, that we don't go around mopey, cry, bitter to the world. We try to make the best of what we have, and I think maybe they're kind of surprised at that.
Yeah.
I've
And
had,
always bright and cheerful unless you got a poor night's sleep.
I'm telling you, we were talking about that Saturday night here. Oh. Will you tell me you want to start now?
Sure.
Oh, okay. Welcome, everybody. And since it's bright and early Monday morning, we're going to assume that either we had a wonderful sleep or we want to find out how to get a good sleep.
That's a good point. The people who are going to show up late are the ones who are really tired.
That's right. Well,
My husband is asleep. He's waking me up.
For those of you who have not gone to a session involving Dr. DeMayo, you're going to find this extremely enlightening and enjoyable. He's worked for over 25 years in rehab and working with people like us who are experiencing a number of physical changes in ourselves. And how many of these conferences have you attended?
I think 3.
3,
Yeah.
okay. So we're going to keep it informal. As far as questions, if you can, if it's possible, like during maybe certain breaks, if you can hold them and then don't have to write them down. I will repeat them to make sure that everybody can hear them, and I think it's a small enough group, so we should be able to cover every question that you may have. So I will turn it over to you.
Very good. This is informal. I left lots of time for questions. I'll tell you how I'd like to do questions. I like to answer the question the best that I can, but then use that as kind of a platform to fill in other things that I might have missed. So I'm hoping that you get just as much, if not more, out of the question session. And sometimes the questions when they're specific to an individual in a group like this, it's hard to just answer the individual question. So please pardon me if I don't exactly get the answer to that question right. The point is to try and use that as an opportunity for everybody to learn. So we're going to be talking about primarily sleep hygiene. It was kind of interesting. I agree that this conference was extremely well organized. The first thing I found that I don't agree with organizationally is they had this talk under a process of aging, I think was the category. And I looked at that this morning and I said, that's not right. I see this is actually just as big, if not bigger problem in folks who are young. They just don't know it. I mean, there is an epidemic of sleep dysfunction. And at least folks who are older kind of were raised in a time where they have some awareness that, they were raised that 8-hour sleep is the appropriate amount of sleep to have. And if they're not getting it, then they might not know how to do it or what to do to get there. But I'm telling you, I do a concussion clinic, and sleep and concussion issues are really important. And they don't get it. These have high school kids and are sleeping 5 hours a night, and they think that's fine. Well, teenagers should get more sleep because their brain is still developing, and they're getting less. Our culture has gotten to a point that, and this is a really good topic actually to Google and read some articles about, but there's an epidemic, no crisis about sleep. And so people define the amount of sleep that they personally need this way. They say, well, gee, I can't function on 5 hours sleep, but 6 hours sleep, I feel fine. Therefore, 5.5 to 6 hours sleep is what I need. And 8 hours sleep just gets thrown out the window. Well, I'm going to use an analogy for that. Let's say you have a friend who buys a new car, and in the owner's manual it says that you should have X number of quarts of oil, and you should change it every 3,000 miles. But this friend decides in his first oil change that he doesn't need that much, and he puts half the amount of oil in it, okay, and starts it up, and it sounds like it's running fine because it's a brand new car. And he says, see, it runs fine. Now, would you not call that person an idiot? But is that not exactly what we do with sleep? And so regardless of how you feel the next day, there's impact that you might not be seeing. And that individual with that car, nobody's going to be surprised when that car wears out early. It has late effects that might not be immediately obvious when he starts up the car. And that's how sleep is. Sleep affects our cognition. It affects things like irritability. It affects mood swings. I mean, we all have mood swings. We all have our days. And if we're not sleeping well on a chronic basis, we have more of those days than otherwise. It affects our relationships. We usually are able to kind of pull ourselves up when we're dealing with other people, but with our spouse and our kids, we just not enough energy, and that's where. So you see people getting in all sorts of relationship problems who are having chronic sleep issues. Just general stress management at work and being able to kind of take the 30,000-foot view and be able to see problems in perspective is much more difficult when you're not sleeping well. Cognitive fatigue is something that we all have. It's important for everyone to take breaks from what they're doing. And there are studies looking at cognitive fatigue in folks with polio. That perhaps that's more, not just physical fatigue, but cognitive fatigue. It certainly sleep affects that. Concentration, depression and anxiety. Folks, it amazes me. And our local area, we have a shortage of healthcare, psychology and psychiatry. And so I think they're doing the best they can. But it amazes me how you can have somebody with significant depression or anxiety issues going through and getting prescriptions for medications, and nobody even talks to them about their sleep habits. And they could potentially double their sleep, and a lot of what I'm talking about are some cycles. So, for example, one of the symptoms of depression is lack of sleep, but lack of sleep causes depression. Okay, so we need to. I look at situations like that where we have these cyclical issues that feed upon one another, and I simply say, where can we have an effect? Where can we do something, rather than looking at the things we can't do something about? Pain issues, very, very, very big issue. When I first started out after my residency, and I tried to kind of explain the mind-body connection with folks who were having pain, I didn't do a very good job. And I'm not quite sure whether or not the culture has changed, that's more acceptable, that people understand that, or whether I've just gotten a little wiser in how I approach it. But the fact is that people can be offended in a physician's office and saying the doctor thinks that pain is just in my head. Well, it is. That's where all pain is. I mean, if you lose your finger, okay, it's not your finger that hurts. It's your perception of that. And I can prove that because we have folks who have amputations, for example, who lose a leg, and they have pain in their foot, the one that's gone. And that can be a chronic long-term problem. So also, if you think about someone who, I use the example of searching for a needle in a haystack. When you're focused on something and you find it, you feel it more, as opposed to the movie with a Vietnam soldier who's carrying his buddy on his back half a mile and hops in a chopper, and he gets in the chopper and then he realizes that he's riddled with shrapnel. He never even felt it. So our focus and what's going on in our mind has a profound effect on pain and how pain impacts our life. And sleep has a very integral part in that. It also has a major part in neuropathic pain because we modulate our pain, especially the neuropathic pain, through descending forces from our brain. So we actually, you don't feel everything, right? I mean, if you're sitting too long on a hard seat, you will feel it. But unless I mention it, most of you probably don't feel the seat that you're sitting on. You don't feel your clothes, you don't feel your shoes, okay? But if you focus on it, you can. And so our brain modulates how much of those signals, sensory signals, get up to our brain. So neuropathic pain is very sensitive to sleep. Muscular pain is very sensitive to sleep. When somebody gets sleep deprived, especially if they're psychologically stressed, one of the reactions is to tighten up your muscles. If you're having muscular pain, you're just feeding into that cycle where you cause more muscle tightness. Hypertension, immune issues. This is not very well described. I think it will be more as we move forward, but inflammatory problems. I could just tell you personally myself that as a physician, there are times that I've gone through periods where I've had very little sleep, and I can feel it in my body. And I've had a couple of hip replacements and generally never had any pain before that, but when I got short on sleep, I did. I get some sleep, it'd go away. So now, is that just muscular? It might be, but I think that there's also some evidence that lack of sleep can lead to immune changes in your body as well. Weight gain. This is I'm finding is a good one for most people. It gets their eyebrows. There's some very nice studies lately looking at weight gain with lack of sleep. One study took, I think it was a couple of hundred patients, and they had one group continue to do what they were doing, no changes whatsoever, and the other group, it was a control group, and the other group, they asked them to voluntarily cut back 1 hour from what their usual sleep was, 1 hour. And in the course of a couple of months, actually I think it was maybe 3 or 4 months, in any case, this group gained an average of 20 pounds. And then they switched them, and they lost the 20 pounds, and the other group gained 20 pounds. And you see, we don't appreciate these things because they happen over a course of time. But a change in an hour of sleep every night on a chronic basis is a big deal. I mean, it really is. There are also actually some studies looking at significant brain loss, a loss of brain neurons in terms of folks who get lack of sleep chronically. So there are very clearly physical effects on our body. We don't have PowerPoint, but I have this one slide. I'll just tell you what it is. It's a web clip from MSNBC. And it's kind of fun to watch because I always like to, if I have a slide that is not scientific, I just say this isn't scientific, you take it with a grain of salt, and that's this case. Because this was a online survey of sleep, and but they had 80,000 people respond. That's a pretty good number. and only 20% got 8 hours or more. 75% got 5 to 7 hours, and 6% got less than 4 hours a night. But then I realized these are the people who are up in the middle of the night taking surveys on the internet. Again, I think that that's not of great value, but it is an indication, out of 80,000 people, there's a lot of people there who aren't getting enough sleep. As you may know, sleep is not sleep is not sleep. There's different stages of sleep. And so we have a tendency to talk about the quantity of sleep. But like many things, there's quantity and then there's quality. And you may be better off with a lower quantity and a higher quality. And it was interesting, I can't see with the lights if she's here, and I don't want to identify her anyway, but we had kind of a fun conversation yesterday after the presentation with the dog therapy, and I was saying I just think it's great stuff, and I said, but I do see a problem with sometimes folks sleeping with dogs. I don't know how we got on that, but we did. And so this woman said, well, I sleep with my dog. And I said, and I'll bet you it affects your sleep. And she says, no, I'm fine. I sleep through the night. I don't wake up. And the conversation went on a little bit, and then she said, well, he does move around quite a bit in the middle of the night. And so I stopped and I said, and how do you know your dog moves around? And she stopped and she said, you're right. I said, because you're not in a deep sleep. See, we can be asleep, but be aware of what's going on in our environment in stage 1 sleep. That's very common. But that's an indication that even though she slept the whole night, she was not getting into a deep sleep. And deep sleep is what we really need. That's where healing occurs. That's where muscle relaxation occurs. So we cycle through stage 1 and stage 2, stage 3. We get down some deep sleep. We get some REM sleep. We do those cycles again. I'm not going to get into obstructive sleep apnea. I'm also not going to get into central sleep apnea or hypoventilation. Those are very important issues. We can talk a little bit about them in the question and answer. I will let you know that Dr. Bach, who I have incredible respect for, gave some wonderful talks, and it's very important. If anybody did anybody attend those Dr. Bach's talks? Yeah, isn't he wonderful? I mean, just amazing. But one thing that's important to know is that it's important to know who you're talking to, and he deals with people who have had significant neuromuscular weakness, and in that population, it's a different population than I might see in my office on a routine basis. And in this room, there may be some people who have those issues, but a lot of people won't. And so some of the statements that he made, for example, CPAP not being helpful. That's in terms of the neuromuscular weakness issue, okay? I use CPAP and it for my sleep apnea, and I don't know how I survived without it. I mean, I lost 70 pounds the year that I started using CPAP. My memory got better, my energy was better. So CPAP in a population of people who have obstructive sleep apnea absolutely is an enormous benefit, but it is important in the polio population. If there's breathing problems or weakness in your diaphragm, then it is important to look at whether CPAP is going to address the issue or BiPAP is necessary. But I'm not. In a question and answer, I can do more on obstructive sleep apnea. Like this is going to be more. We're focusing on sleep hygiene. So I was talking a little bit about the stages of sleep. One of the sleep hygiene issues that I often talk about is sleep priming. Okay, what sleep priming is bringing your mind to a peaceful place before sleep. And we can talk about that more as we go on. I might have a couple of other slides that will come up. But it's the antithesis of watching a horror movie before you go to bed. Now, anybody would agree that if you had a 6-year-old and they watch a horror movie before going to sleep, they might fall asleep, they might not wake up, and they might even forget that they watched it, but they might look really tired the next day. Does that sound reasonable? And I would just say, what makes us different? Okay, the difference might be that instead of watching the TV with the stupid guy with the hockey mask, we're watching our own horror movies, right? How many of us lay in bed and we just kind of think about, and we don't think about the nice stuff, do we? It's all the problems and stressors of the day come to our mind, and we rehearse them, and we go over it again and again. But we're the producer, and we're the editor. And so it actually has a much bigger impact on our sleep than some stupid horror movie. But people don't think about that. And so what sleep hygiene is saying, I'm not going to do that anymore, I'm going to do this. And typically what happens is this will come back into your mind, you say, I'm not going to do that, I'm going to do this. What this is highly individual. But it can be anything from meditation to prayer or scripture to listen to relaxation tapes. There's a lot of different things. But the point is, it should be fairly monotonous, it should definitely be peaceful, and it should be something that is repetitive. And so it's not stimulating. There's no reason to stay awake doing it because you're doing the same thing again and again and again. So that would be a form of sleep priming. But even just having some quiet time, but not doing this, or meditating on the positive things in your life, those can all be sleep priming. It's bringing your mind and your spirit to a place of peacefulness before you get into bed. Because again, we all know that having been bombarded by negative thoughts. By the way, and I won't ask for a show of hands, but the number of people who watch the news as they fall asleep. I mean, we don't think about it, but it's all whitewashed. But we're talking about rape, murder, violence, political, upheavals, hurricanes, tsunamis, and then we fall asleep and have a nice, peaceful sleep. Doesn't that sound silly when I put it that way? but we all do it. I've been guilty of doing that, but it just doesn't make any sense, especially if we're having sleep problems, to put that stuff in our mind. Now, I'm not saying the news is bad, but watching it earlier in the evening or in the morning or in the middle of the day, but not as the last thing you do, and certainly not in the bedroom. Definition of insomnia. The National Sleep Foundation showed that a third of the population has suffered insomnia in the past year, and 10% of people have chronic insomnia problems. And there are a couple of different definitions of insomnia, but basically it's insufficient sleep leading to not feeling rested on a habitual basis. And the American Psychiatric Association defines it similarly, but basically says a non-restorative sleep with associated impairment or significant distress for at least 1 month. So it does not mean, it is not defined by the number of hours of sleep that you get. There's no mention of the number of hours that you get. And that's because you can have insomnia and be sleeping 10 hours if you're getting a really bad sleep, right? So if somebody is chronically stressed, or if somebody is worried when they fall asleep and not getting into a deep sleep, if someone has sleep apnea and every time they go into a deep sleep their airway closes off, they don't get any deep sleep, okay? That would be defined as insomnia. Now, the next question, though, is how do we define restorative sleep? Well, a lot of times it's only obvious with the retrospectoscope. In other words, you can't see it. There's a scale called the Epworth scale that looks at sleepiness during the day. And if your score is high enough, then it supposedly correlates with sleep apnea. My Epworth score was like 2. I mean, it was almost nothing, well below average. And I knew I snored, but I had no idea that I had sleep apnea. And my wife is a physical therapist. She didn't think I had sleep apnea either, because it happened later on at night. But the reason is because I'm too busy to be tired. I get up, I'm a little dragged to the shower, but once I'm in the shower, we're on, I'm go. And I'm exhausted at night, and so I collapse, I fall right asleep. So I didn't have any sleep problem. Well, one day, my son had a soccer game, and it was raining, and so it was rained out, and I found myself not having anything to do. And so I laid down in the bed and fell asleep in the middle of the day. That does not happen. And I fell asleep on my back, and just a short while later, I woke up in the middle of a snore. And I said, I know what that is. And so I did a screening of myself, and I pinned this thing. I had severe sleep apnea. And so then I went for a sleep study and confirmed it and treated myself. And I had so much more energy when I treated myself. And so I wouldn't have complained about it before because I didn't see it. But in retrospect, I had so much fatigue and lack of energy and concentration and memory difficulties, I didn't realize it till it was gone. And that's just the way some things are in life. You don't realize until they're gone. Relationships, things like that, sometimes we don't realize until it's gone, how much we were affected by it. So again, that's the definition of insomnia, and that lack of restful sleep is not quite as easy to pinpoint as we would think. The other funny thing about my sleep study, since I was talking about that, is that I mentioned that we can be in stage 1 sleep and not realize it. And if anybody's ever had a sleep study, you're wired for sound. I think it's fun. I mean, it was, you know, I'm like looking at all the machinery and things. But you have an EEG, you have these lines on your head. Oh, by the way, they do have a subset. They don't do all the tests, but the sleep studies can now be done at home. For obstructive sleep apnea, there's the best use of them. But I had the full sleep study with the things on the head, things on your chest for EEG, things on your legs for an EMG. They have a thing for measuring your breathing, a thing for your chest. I mean, you're just wired, you know. And so then it's like, okay, go to sleep. and so I remember laying there and thinking, you know what, if I don't fall asleep soon, because they only give you 6 hours, the place I went, and I said, if I don't fall asleep, they're going to have me come back again. And so I remember, you know, turning over from one side to the other because I didn't want to disturb the wires, and I said, oh, I hope none of them got loose. And then I, you know, waited, you know, what seemed like another eternity and rolled back again. I thought, yeah, I'm up the whole night. Well, I get my sleep report, and there's something called the sleep latency. And this is all to simply talk about this is uniformly our inability to judge our own sleep, is my point here. And so I get my test, and I look at the data, and in the data, it has my sleep latency. Well, it cannot be, you can't make an error with this, because the light switch is when they define the sleep study starting, when they turn off the lights, is hooked right up to the computer. So it's not like they wrote it down wrong or something like that. And then the EEG is on the same screen. You can see the light switch went off, here's your EEG, and this is when your brain waves went into stage 1 sleep. 6 minutes. It took me 6 minutes to fall asleep, and I thought I was awake for hours. So when I, you know, sometimes we can't say, oh, I had a good sleep or I didn't have a good sleep. We need to look at our life and look at the issue of, you know, are we having fatigue? Are we having concentration problems? Are we moody and irritable? Do we have the symptoms of sleep deprivation, even though we think we might be sleeping okay? It's kind of weird because you think a person would know how well they slept. You know, when we say, how'd you sleep? You know, well, sometimes we know and sometimes we don't. So chronic insomnia is defined as lasting 6 months or longer by some, 3 months by others. Once things become chronic, it is more difficult for folks to change their sleep hygiene, folks to change their habits. But the key word is more difficult. I have never been a proponent of the saying that you can't teach an old dog new tricks. You certainly can. It's just more difficult. But if you have a will and you want to change, then you can change. Some of the reasons for having poor sleep, these are pretty self-explanatory. Pain can interfere with sleep. Stress and anxiety can interfere with sleep. Medications, people don't think about caffeine and alcohol, but those certainly have a medication effect. And some of the prescription medications we take or over-the-counter medications we take can certainly have an effect. Your environment, you know, certainly noisy environments can be a big factor. Sedentary lifestyle, lack of exercise can impair your sleep. Urologic issues, having to get up, older men with prostate problems, having to get up 4 or 5 times. Urinary tract infections, things like that certainly affect your sleep when you have to get up. But for the purposes of this lecture, we're not going to be focusing on a lot of those. We're just mentioning those to be for perspective. We're looking at poor habits and changes in behavior as reasons for sleeping a problem. The issue of sleep overlaps, or the issue of sleep hygiene or habits is not the whole picture. It's just the part that we're going to be talking about now. There are, as I mentioned before, sleep disorders. So someone can have obstructive sleep apnea. They can have central sleep apnea. There's something called periodic limb movement disorder, which is a variant of restless legs. So if you're feeling restless during the day, like your legs are moving, that oftentimes can translate into a poor night's sleep, and if that's treated, the person sleeps great. So that's a medical condition to be evaluated. There are other medical issues that have effect on sleep, but are that effect sometimes is not really discussed outright. But I mentioned urologic issues, but chronic lung problems, reflux esophagitis, certainly laying down flat and causing reflux can impair some people's sleep, Parkinson's and mood disorders. There's lots of other medical conditions that can also affect your sleep. Now, even in those situations, however, sleep hygiene is very important. And it's a funny thing, but I've been working with folks with sleep issues for years. And what happens is that oftentimes people who have a sleep difficulty for a specific reason then develop bad habits that make the sleep problem worse. So for example, it would be clear that doing something stimulating is not what you want to be doing during your sleep time. So sleep hygiene, you want to schedule 8 hours sleep, and you really don't want to do anything stimulating during that time. But let's say that somebody has a medical problem and they're awake for a gap in the middle of the night. Well, it's just very easy for folks to turn on the TV. And they think what they're doing is they're helping by distracting their mind. But they're not. They're stimulating. Okay? And so I use the analogy that if we're trying to train ourselves, and sleep hygiene, I look at sleep as a trained behavior. We use the term, even the terminology we use reflects the culture. We talk about falling asleep. It's a very passive thing, okay, as opposed to going to sleep. It's as if we don't have any control of it when we say we're falling asleep. So my point is that if we're going to take the bull by the horns and say, okay, we're going to train ourselves to sleep, we need to look at it like other trained behaviors. And so if you have a goal of sleeping 8 hours and not waking up, as opposed to a goal of training a dog to be housebroken, right? So you don't want the dog to pee in the house, you don't want to wake up. With the dog, anybody could see that if the dog does the opposite of the trained behavior, and he pees on the carpet, the last thing you want to do is make him feel better. You don't want to say, oh, poor doggy, and give him a doggy treat. What's he going to do? He's going to do it again, absolutely. But yet they don't see that if they get up in the middle of the night and have a snack, or turn on the TV, or read, or turn on the computer, they're all doggy treats. They feed into that behavior. Now they do distract, they make us feel better because we don't like the fact that we're awake in the middle of the night because we want to be sleeping. And so they distract us from that feeling. But that's no different than the dog putting his tail between the legs. In essence, I know this sounds horrible, but if somebody's training themselves to sleep and they're up in the middle of the night and they feel miserable, good. Because the next night, they're less likely to wake up. Right? You don't want to reinforce that time as being a time that was comforting or that was good, because you're more likely to do it again, just like the dog is more likely to do it again. And you don't want to be abusive to the dog, but you do want to have a negative response. And so I'm not saying, give yourself lashes or anything. What I am saying is avoid the positive reinforcement of that behavior. A sleep log can be very helpful. Again, a lot of times people, it just becomes the norm. This is me. I've never slept that much, okay? Well, first of all, never's a long time, and secondly, that kind of thinking doesn't allow for a objective look at the problem. And so a sleep log can be eye-opening. It's analogous to, if anybody's, my weight goes up and down, and it doesn't go up slowly, it goes up very slowly over time, and then I just say, I've had enough of this, and I will lose 50 and 75 pounds. And one of the primary ways I do that is I write down what I eat, and I do electronically now, but just enter what I ate. And in essence, if I'm looking at the problem, it gets better. If I'm not looking at it, it doesn't, right? And so I just don't think about it. We have a fast, kind of a convenience store kind of thing called Sheetz in Pennsylvania. And so I'd, stop for a coffee, and I had not had breakfast, so I'll grab a little breakfast muffin, and they're 2 for $2.29, so that's a deal. So I'll take 2 of them, and I have 2 of them before I get out of the parking lot, and I've had all the fat and calories I should have for the day. Why? Because I wasn't looking at it. I can guarantee you I will not do that while I'm keeping track of what I eat. I just don't. And so keeping a sleep log can be really eye-opening. So keeping track of what time you went to bed, what time you estimate you fell asleep, although again that can be inaccurate, the number of times that you woke up, as well as what the cause of the awakening might be. And there's some things that you can't control. The kids waking up. Okay, that stuff happens. But at least you can see it for what it is. Any nighttime symptoms, pain, shortness of breath, anxiety, the time that you got out of bed, the time you woke up, and as well as any napping that you did during the day. There's also something called actigraphy. And actigraphy used to be very, very expensive. And there are still medical-grade actigraphy machines that are very expensive in the thousands of dollars. But more and more, there is consumer-level products. These are some of the sleep tracking or the activity tracking bracelets. And there's a lot of different products out there. But they are helpful not only as activity monitors, so for example, they'll tell you how many steps that you took by your arm swings, but they can also track your sleep. And they can give you a report in terms of when you went to bed, what time you got up, by your motion. And I'm not sure that I haven't gotten into them enough. I've used them a little personally, but I haven't really studied them enough to correlate them with the medical grade ones. But they claim to be able to even give you a report in terms of the quality of your sleep, because when you're in deep sleep, you don't move. And so these supposedly can give you a report of how much deep sleep you got because you weren't moving at all. And so we're talking about $100, something like that, for some of these products. So they're certainly worth investigating. And the nice thing about that is it gives you objective feedback, especially in this population here. I mean, this is a population of folks who knows what it's like to set a goal and to work hard to achieve it. But it's a lot easier when it's tangible. And so if you can see something on a graph, okay, it's a lot easier than this nebulous, I'm going to get a better night's sleep, especially since we're not a very good judge of our own sleep. So either a sleep log or actigraphy or some type of objective measure can be very helpful. I mentioned pain, and I want to kind of reemphasize, especially with chronic pain, the importance of sleep. That while patients oftentimes will talk about how pain leads to sleep problems, as if that's a one-way deal, it's very important to look at the other part of the cycle, that sleep problems lead to pain. And so it's not simply an issue of if we get rid of the pain, the problem is gone. Because as I said, oftentimes you get the pain leading to sleep problems, then you develop other behaviors that make the sleep problem worse, which makes the pain worse. Okay? It's not the problem. And I oftentimes, with my patients in the office, I look at their eyes, see how well they're taking on it, and sometimes I kind of see them like, okay, it's as if I'm not validating their pain, and that's not the issue. I use the analogy, it's as if pain is a fire, okay? And they're coming to me and they want me to put the fire out. They've been to 10 other doctors and they haven't been able to put the fire out. All they want is a fire extinguisher to put the fire out. But the problem is that they're pouring gasoline on the fire. And that's what the insomnia is. It's like pouring gasoline on the fire. And it can be downright impossible to put the fire out if you don't stop pouring the gasoline on it. So the sleep problem is not the issue, but it is the first step in solving the issue. If you're a fireman, you go to a fire and there's fuel pouring on the fire, you're not going to take out your hose and your fire extinguishers. The first thing you're going to do is turn off the fuel. And so that's the relationship between sleep and pain. The pain is the issue you want to address, but oftentimes you need to start upstream and work on the sleep issue first. And using the excuse that the pain is the only problem causing the sleep problem is usually naive. There's usually many, many other factors. How do I know that? Because everyone has, one time or another, had problems with sleep hygiene. We're all human, and we all have these responses to not sleeping that feed back and make our sleep even worse. Okay, other effects of training. Consistency is very, very important. What are we doing on time?
You're all right.
Okay.
You said you wanted to get about 20 minutes.
Yeah, so I'm gonna
Questions. So
speed
you
up a
still got about
little
another
bit.
10 minutes.
Okay. I like the analogy. I hope people don't mind being compared to dogs, but I like the analogy. And I'm not a dog expert. My wife's father is a veterinarian, very well-known horse veterinarian. And so she's had animals her whole life. And I grew up with 5 brothers and sisters and goldfish, and my parents felt that they had enough animals in the house, you know. And so we never had a dog until we got married, and we got a Dalmatian, beautiful Dalmatian. And soon after that, we found out that Lori was pregnant. Dalmatians are not the best dogs to have with little kids. And this dog, they're just hyper. I mean, and so we said, while Lori is pregnant, we said we need to address this because we want to keep the dog. We need to make sure this dog is trained well. So we hired a trainer to come in and train us to train the dog. And so he asked some questions, and he said, what time, when do you train the dog? And we said, whenever we get the chance. He said, you can't do that. He said, you need to be consistent. You need to train the dog the same time of day before you feed him, like clockwork, exactly the same time. You need to call the dog from the same place in the house, have him sit down, walk him to the closet, have him sit down again, open the door, put the leash on him, close the door, everything consistent in exactly the same order. You bring him to the back door, he sits. He walks through, he sits. And then you bring him up to a back corner of the backyard where you don't play with him, and then you start to train him. And I'm telling you, 5 days of this consistency, and this dog sat calmly, looked up, and just basically said, what now? He was all ears. Because he didn't know. He didn't know when we were training versus when we were playing. So I ask most people, how does your body know it's time to sleep? I feel tired. Well, that's not a good answer. You know, that's not, if you're gonna train your dog, you're not gonna say, well, he's gonna poop when he feels like pooping, right? I mean, that doesn't work. If you're gonna take the bull by the horns, you need to make your body know when it's time. And that's where this consistency comes in, with a pre-bedtime routine, relaxation, very scheduled. And look, if you're not having any sleep problems and you want to vary your sleep time a little bit and you're waking up rested and you don't have any issues, then fine. But I'm guessing most people are here because they're having some sleep difficulties. And so being really rigid about that is something, I'm not saying that you need to do it, I'm saying you might want to do that because it really can help with that training effect. It's remarkable how that works. We talked about a positive reinforcement of the undesired behavior, TV, reading, eating. Some of the, there's something called cognitive behavioral therapy. And by the way, I'm a real proponent for working with psychologists, and sometimes people, kind of have some hesitation, like they're going to, get into, your childhood or something like that. That's not what I'm talking about. I'm not talking about Freudian analysis here. I'm talking about seeing a good, practical psychologist who's going to give you some good practical advice for you. And you might need to see 2 or 3 people before you find one. But you know what? This is a bright population. You guys can, on one visit, know if somebody's going to help you or if they're not. But seeing somebody who can connect with you, who knows you, and can help you with things like progressive muscle relaxation, guided imagery, biofeedback, controlling stimuli. There's hypnotherapy can be helpful in some people. And there's other techniques that can be used to affect how your mind is prepping yourself for sleep. So relaxation tapes, relaxation apps. I mean, lots of people have iPhones or smartphones, and go to your app store and put in relaxation. There's some great stuff there. There's everything from sounds to progressive guided imagery stuff that can be very, very helpful. Nicotine, we talked about alcohol and caffeine a bit. Caffeine, by the way, a lot of people think, oh, well, I don't drink caffeine at night. But daytime caffeine caffeine stays in your system for 12 to 14 hours. So even if afternoon can affect you. You really want to limit caffeine if you're having sleep problems for sure. And if you're drinking a lot of caffeine, you're not going to want to stop, though, because you'll withdraw. So I recommend people go to 50-50 and then transition down. Nicotine can affect sleep, and interesting studies have shown that depends how you smoke. If you smoke very slowly, it can be a sedative. If you smoke very quickly, it can actually be a stimulant. Exercise, we talked briefly about. I'm going to scroll through here. We talked about pets. So to wrap up here, the do list. Set a specific bedtime and wake time and stick to it. Have a bedtime routine, the sleep priming we talked about. Adaptive in your environment. Body pillows. I love body pillows, especially for pain issues, shoulder, back issues. If you're not familiar, body pillow is usually a 5-foot long cylindrical pillow, and it allows you to lay on your side, but what I call semi-prone. You're half on your side, a little bit on your stomach, so half your weight is on the bed, half your weight is on the pillow. You drape your arm over it, you drape your leg over it, and excuse me just a second, Elliot. It allows you to spread the weight from the bed to the pillow, so half and half, so actually you're able to stay in one position longer for that reason, but also keeps a nice neutral spine. It supports your leg, so hip and sacroiliac problems are addressed, and can support your shoulder. So I'm a big proponent of body pillows. Avoiding laying in bed awake. Now this sounds counterintuitive, but again, getting back to the training effect. Laying in bed, and also, by the way, these are the ideal that I'm talking about. If someone is not able to get out of bed alone, or if they have a brace to put on in order to get out of bed, or it's just going to be, a big ordeal to get out of bed, then that's, obviously that's not going to work for you. But if possible, if you can restrict the time that you're awake in bed by, and the books say 10 minutes, but I usually say, anywhere from 15 to 30 minutes. If you're not sleeping, get out of bed. And the reason is because we want that bed to be associated with sleep, not being associated with being awake. And so, again, if we look at the training effect, we think command response. So if we are looking at training a dog, let's say a dog is trained to sit, okay? You say sit, the dog sits. 1-to-1 is the goal. Every time you say sit, the dog sits, right? That's what we want with your relationship with the pillow. You lay your head in the pillow, you fall asleep. Pillow, sleep, pillow, sleep. Now, if you take that dog that's well trained and you take him on a walk and you don't let him sit, but you use the command to sit thousands of times, and you say sit, 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 but you keep walking and you do that 2 hours a day for a week, is it surprising at the end of that week the dog comes in the room and you say sit and he doesn't sit? He might go to the front door thinking we're going for a walk, correct? Well, if you lay your head in the pillow and you're laying there awake, 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 you can't be surprised that the next night when you lay your head on the pillow that your brain says, time to lay here awake. Now contrast that with if you get out of, let's say you have two people and they're going to be awake for 4 hours in the middle of the night, okay? And person A lays in bed for 4 hours, and person B gets out of bed, sits in a chair, listens to some relaxation tapes or does some meditation. They're still not sleeping, okay, but they're not in bed. Now, someone could use the argument that on that one night, at least this person was laying down and physically got some rest. I get that. That's a reasonable statement, okay? But that's not the issue. What we're looking at is chronic sleep issues. The issue is the next night, okay? Person A lays down in bed, and they say, I remember this pillow. I laid here for 4 hours awake. That's what I'm going to do again. Person B says, I remember that pillow. As soon as I put my head on that pillow, after 4 hours, I fell asleep. Oh, that was so nice. I want more of that. That's one night. Does that make sense? Okay. And I'm telling you, it has a big, big, big effect. I'm going to wrap up just talking a little bit about the holistic approach to sleep. And as with pain issues, I really try to approach things holistically. I think it's very important to look at not only the physical issues of how pain affects sleep and how sleep affects pain, but emotional and psychologically, how they affect one another, and as well as spiritually. Now, in our healthcare environment, in our culture, you don't hear many healthcare providers talk about spirituality. When I was trained at Columbia, they said very specifically, don't go there. Don't bring it up. And what they were afraid of, they were afraid that somebody would, that as a physician you would step on someone's toes. And I did that for about a decade, and about 10 or 15 years ago, I began realizing, I could be respectful of people. I mean, I'm not telling them what to believe. I'm simply asking them to think about what they believe and use it. So that I had, if somebody is Buddhist, Buddhists have a lot to say about relaxation that can be very helpful for sleep. Right? I come from a Christian background. I might throw out a Christian example or two, but it's just an example that's not for that person to use. They should use what their beliefs are. So as an example, I'll wrap up with this and we'll get to questions. I had a gentleman who came to see me, and he was in his 30s, I believe, with chronic neck pain. He was like this. And he was sleeping 2 hours a night. And I just said, there is no way I'm going to get your neck pain better until we get you sleeping better. I said, why do you think you're not sleeping? Well, he knew why I wasn't sleeping. Going through a divorce, custody battle for 4 kids, lost his job, and he got an eviction notice for his house. Okay? So, I mean, we're laughing because we can see this guy laying in bed doing this. He's watching his horror movie every night. So whenever I have sleep issues, I always bring up spirituality, and I just ask the person, is your spiritual life important to you? I often get the answer no. I can tell you I've never met an atheist in my office, not one. A lot of agnostics, a lot of people who say that they're not sure, that they don't know what they believe, but I've never had somebody who categorically say, no, there is no God. And so what he said was, I don't have a spiritual life. And so I said, well, I'm not talking about religious life. I'm just talking about spiritual life. Do you believe in God? And he goes, well, sure I do. And I said, well, what does that look like? He goes, well, I'm not Christian or anything. I don't go to church. I said, I didn't ask that. Just tell me what your beliefs are. He said, well, I live in the woods, and I go for a walk every day, and I just have a feeling God is there, and I talk to him. I said, so you talk to God every day? And he said, yeah. I said, well, I have news for you. You have more of a spiritual life than a lot of people who go to church once a week because their mother or their girlfriend are dragging them there. And that was his spiritual life. And so the point here is that once he was able to put that in words, then it was very easy to turn that around in a way that he could use this in a very practical way for sleep. So what I suggested, and again, it was a suggestion, he needs to decide what works for him, was to sit out on his porch before he got into bed and do some sleep priming by looking at the stars, listening to the crickets, and talk to God the same way he does when he goes for his walk. But can you imagine the difference there? You have somebody who spent 15 minutes talking to God versus somebody who's laying there thinking about all these problems. Who's going to sleep better? Right? He comes back, he's sleeping 5 hours, which is not great, but that's without medications, and he looked like a new man. I had something I could work with now. And this is a guy who said he didn't have any spiritual life. So, bless you. And even if someone doesn't know what they believe, simply taking some time, peaceful relaxation time, and contemplating the creation or the universe or the stars, those can also all be spiritual experiences. People can have spiritual experiences meditating about a mountain stream and things like that. The point is it takes you out of yourself and it takes you away from this stuff, which is really a problem when it comes to sleep. So I could go on, and I want to make sure that I get to questions. Do you want to?
Just about right, 20 minutes.
Very good.
But I don't want to put you off. Finish.
No,
You're all done,
yeah.
Okay. Questions?
What about naps?
You have to repeat the questions.
Pardon? What about naps, she asked.
I'm just asking to repeat because we want to make sure we get the
Yes.
recordings, and I'll forget. When I get talking, I'll forget about doing it. Really good question. Naps can be a blessing and they can be a curse. If I do a concussion clinic, and oftentimes folks come in with concussions, and they've got what we call hypersomnolence. I mean, some of these people will sleep 12 to 16 hours in a day, and that's just what their brain needs to recover. And so by all means, those folks need to nap as much as they can. But what I do say is once they start to heal and their sleep requirements go down, that they need to be very careful about naps not interfering with their nighttime sleep. So when they get to the point where they're napping for 2 hours in the afternoon and they're waking up in the middle of the night, they need to cut down the nap, okay? So you don't want, a nap can be really great and can be restorative, but you don't want it taking away your drive to get down into a deep sleep. And so if you're getting an adequate amount of sleep at night and a good quality sleep at night, and you supplement that with a nap, there's nothing wrong with that. But I do think it can be a real problem if somebody thinks that they're sleeping 3 hours, then they're awake for a while, then sleeping 3 hours, and then they sleep 2 hours in the afternoon. We can add all that up to 8. It doesn't work that way, okay? Because it takes time to cycle through the sleep, and you need continuous sleep. So you just have to be aware whether it's helping you or hurting you. But that's a really good question. And by the way, you don't necessarily need to be asleep to rest, right? To have a habit of physically taking a break and sitting down and doing something that's mentally or spiritually relaxing in the middle of the day and having a little mental vacation and physical vacation and break in your day doesn't necessarily mean we're asleep, right? So if somebody's having sleep problems during the day, they can do that in the afternoon, and that can be very helpful. Okay.
Who's next? Yes.
In sleep, you didn't mention, I don't believe, anything that may affect you. Like it might be a good idea to have something over your eyes and your ears, but LED lights are a big problem, especially even a digital clock. And people would never think that something like that would affect them.
You mentioned that the things that you can put over your face, but also, for instance, lights. Many of us have the clocks or TV lights or anything else. Would that disturb because it's lighter in the room?
Absolutely. I think I glanced on it by just mentioning environment, but the list can go on and on and on. It could be sounds, it could be lights, it could be other activities going on. And so you're absolutely correct. And the other thing, for example, clocks are kind of a double whammy because it's not just the light; it's also the kind of perseveration of what time it is. It kind of feeds back and kind of increases your anxiety. Oh my God, I'm not sleeping, and that kind of thing. Sleep masks, earplugs are some very kind of low-tech ways that are really helpful. Certainly having really thick blinds, and it doesn't really matter if you're sleeping at night or during the day. I mean, there's certainly people who work nights and they can sleep during the day, but having a dark environment is important. So if somebody's going to work nighttime, then you really want them to get the blinds that are just going to totally blacken their room, make sure that they have some sound protection, whether it be earplugs or just make sure they have a non-noisy environment. Sound machines can be very helpful. Interestingly, a lot of people sleep with the TV on, and they think it helps me sleep. No, it might distract you, but it's not helping you sleep. Both the light, okay, is affecting you, and I think I'm glad you brought that up. It's a really good point. But they say they like the sound, but they're listening to it. They're not aware of it, they don't remember it, but they're listening to what's happening on that TV. And there are people can be in the hospital and be comatose and come out of it and remember what their doctor said in front of them. I mean, this happens. And so to think that somebody is having a poor night's sleep and not paying attention to what's happening on the TV is folly. Of course they are. And it's more and more stimulation. What it does do is this, and I have a nice little graph that I when I have a projector that I use. And it basically is a progressive line, and on one end is total peacefulness, like we won't have in this life ever, and over here is the most gripping part of a horror movie, where you're just totally wired, okay? And here's neutral. Well, most of us live our lives kind of on this side of neutral, don't we? I mean, I do. I mean, we're just go-go. We got a million things going on in our culture. And so somebody is trying, they know they need to sleep, but they know that they're not going to sleep when they're kind of stuck in this position, okay? And so what TV does is it distracts us from where we're stuck, okay, and brings us to a different place. But the problem is, it's still all the way over here on the stimulation end. And so they think it helps them sleep. Well, it got them unstuck, and so they did fall asleep, but it's still very stimulating. Doesn't it make a lot more sense to do something peaceful over here? So not only do you get unstuck from where you are, but you bring yourself to a sense of peacefulness. So I think it's really debatable saying that TV helps anybody sleep. It might be a part. I mean, I don't have a problem with TV, by the way. To watch some TV, to unwind a little bit, and then after that, do your progressive relaxation and be peaceful before going out. That makes a lot of sense. But just don't kid yourself that the TV, between the lights and the noise, is going to be something that helps you sleep. So, very good point. Thank you.
The lady.
So the sleep below sounds, is it because it's repetitive that it's okay, whereas the TV is different?
Yes.
Did everybody? No, that's
Go ahead,
okay.
no, go ahead.
You had mentioned about the sounds, the music, or something that's soothing. It's repetitive, and she's saying, is it because the other sounds are not repetitive that it can hinder your sleep?
Exactly, and so it's not, once something is repeated, it's not like it's not stimulating anymore, right?
Kind of train.
Hmm?
Kind of train that's going good, it just goes on and on, and really sleepy seconds, switch it off, we wake up.
Yeah. So there are lots of apps, or you can buy a sleep machine that produce everything from waterfall sounds to rain. Of course, those are problems if you have a prostate problem, I suppose.
Sound in the shower. Yes. The lady in red.
I'm a night nurse. Is it better to work 3 shifts in a row, nights, so that you're used to sleeping during the day, or is it better to space them out? I haven't figured it out, but I've been doing it for a year.
Okay, is it better to work 3 nights in a row or stagger them throughout the week?
Yeah, I tell you what, I have not figured that out, and it is just, it boggles my mind that the healthcare profession, which we be an example to folks, I mean, nursing is one of the most dysfunctional, work places in terms of sleep. And it's horrible. I just don't get it. So I just don't have an answer for that. A sleep log might be helpful for you. You might want to see kind of which pattern works for you. But the point is, either way is not going to be consistent, right? Now, for somebody who works nighttime shifts every night, and they're staying on that all the time, then that's different. But you're talking about 3 overnight shifts, and then you have 4 times you're going to be up during the day. I'm not sure that I have a good answer for that, because it's kind of hard to get into a real sync either way. But I'm guessing that that the consistency of working the night shift exclusively and not switching it back and forth would be better to get in some type of habit.
What would be the best way for her to get to sleep? Yeah, knowing the changes of. I get it.
I figured that.
I get about 2 hours of sleep a night when I'm working. I mean, a day.
Yeah. Well, basically everything we talked about in total, and again, a sleep log might be something that's really helpful, including writing down exactly what you're doing before going to bed each time. My guess is that You do different things at different days, whether you're working or you're not working, how much time you have. You get home and you've got, a couple of bills to pay or something like that. I'll do that before I go to sleep, or stuff. Just, people who work inconsistent hours and then kind of squeeze in their sleep into their life, oftentimes just squeeze other things into when they go to sleep. And so it's much more difficult, but all of the principles I just talked about in terms of consistency. But by the way, I have a website, DeMayoClinic.com. It's self-made. It's nothing impressive whatsoever. But if you go to the left-hand side of it, I think it says patient information or education or something. In any case, there's a handout on sleep there, which has kind of a recap of the sleep habits that we're talking about. I would think that for you, and this is very individual, so I would think for you having a conscious effort to do that peaceful relaxation every night, and this is not just the night you're having problems sleeping, because then it becomes associated with problem sleeping. You do it every night. And so what you want is you want to do the relaxation and have a good night's sleep. Do the relaxation, have a good night's sleep. And then when you work and you think you might not sleep that well, you do the relaxation. After time, you're going to be in the habit of having that followed by a better sleep.
The gentleman in gold. Yes.
Okay, when you sleep at night, all of a sudden you feel like if you stop breathing, your body takes and jump up. And now you refuse to sleep because you don't know if you will die.
Okay,
Scared of sleeping.
he's concerned when he's sleeping at night, all of a sudden he wakes up, he's not breathing, or you stop breathing, and so now he's concerned.
And I think you should be. And that what you're describing sounds very much like obstructive sleep apnea. That was the experience that I had when I laid down that afternoon when my son's soccer game was canceled. I laid down and woke up and I took a deep breath, and after a breath I was fine. But that sounds very much like sleep apnea, which is common to begin with. It gets more common as you get older. It's more common if you have any type of neurologic condition. It's more common if you gain weight, but it can happen to anyone. I had a very thin, young woman in my office who had significant sleep apnea. So that's important to address. Now, very briefly, what happens with sleep apnea is that normally there is muscle tone in our bodies. The reason, you might not feel like you're working your muscles right now, but if you weren't, you'd all be on the floor, right? So there's a normal amount of tone in our muscles just in terms of keeping our posture. There's also a normal amount of tone in the muscles surrounding our airway. And we have it all day long. And we have it most of the night, except when we go into deep sleep. By definition, deep sleep means all of our muscles relax. Now, the difference between someone without sleep apnea and someone with sleep apnea is someone with sleep apnea need that muscle tone to keep the airway open. Okay? And so when they go into deep sleep, they lose that, the airway can collapse. And the best example I have of that is if you all remember the plastic or the wax paper straws they used to have years ago, right? The cheap ones. And could you imagine trying to drink a milkshake out of one of those, right? What would happen? It would just collapse and it'd be flat, okay? And that's what happens with somebody with sleep apnea. You're trying to suck air in, there's no rigidity, and just goes, and it just collapses, and so no air comes through, okay? And so it's very important to have a sleep study in that case. And if someone does have sleep apnea, the treatment is CPAP, continuous positive airway pressure, sometimes BiPAP if there's other problems, if it's more complicated, which is it's a bimodal pressure. But the point is, it is analogous to blowing through the straw as opposed to sucking through it. There's no reason for it to collapse because the pressure inside the airway is higher than the pressure outside. And so those episodes completely go away, snoring goes completely away, and it's remarkable the difference it can make getting down into a deep sleep once that, but in my experience, and it's, maybe it's just hard to convey in textbooks because they don't teach you to ask about this, but having had that personal experience, I ask all the questions about sleep, but specifically one that I ask whenever I suspect somebody might have sleep apnea is, do you ever wake up with a snort? And do you ever go, and so, yeah, I do that. I tell you what, that is just, to me, that is sleep apnea until proven otherwise. There's nothing else to do. There's no other reason why that would happen. So what happens is when you go down into deep sleep, your muscles relax, your airway closes, your lungs are getting no air. And so obviously you're using oxygen because you're still alive, but you won't be for long, right? And so your brain senses your oxygen level goes down, it says emergency, and it starts to wake you up. Now, rarely when that happens, you wake up so quickly, you wake up with a snort. But in somebody who's having that problem, hundreds or even thousands of times for every one time you wake up, it's just waking you up enough to go up into a low level of sleep, muscle tone comes back. So when you ask the spouse, you'll say, do you see a pattern like this? The person is snoring, then they're quiet, and they think they're sleeping peacefully. They're not. They're dying. They're not breathing, okay? And then, after that quiet, they kind of go and take a big sigh. Yeah, that's it. That is sleep apnea, okay? So, the answer to your question, I think, is really getting a sleep study. That sounds very much like sleep apnea.
Yes, Van Beck.
Speak a little about medications.
Sure.
Medications, what his opinion is.
Thank you. I will just try to answer it. Yeah, and I tried to keep my remarks as brief as I could, and I could do a whole hour just on medications. That issue breaks down into two. One is the negative effect that certain medications can have on your sleep, and the other one is whether or not medications are helpful to prompt you to sleep. I mentioned the former briefly, but I do think, since you're bringing that up, to address that just a little bit more, anybody who's taking any kind of prescription medications or over-the-counter stuff, or herbs for that matter, my God, I mean, I'm fine with complementary medicine, but let's not kid ourselves that herbs and other complementary products don't have side effects. I mean, that is just silly. So I would take a list of all the medications, prescription and non-prescription, all the herbs or anything else you're taking, and bring it down to your pharmacist and say, hey, do you think any of these could be helping? He'll run it through the computer and give a look-see at some of those things, and then you can talk about those with your physician. So, and sometimes it's surprising because sometimes there are medications that aren't commonly the problem, but they can be, and so sometimes it makes sense to work with your physician, hold that for a little while, see if it's affecting your sleep. So that's on the one hand. The other hand is, did you have another?
No, I was really thinking, my question was more about things that you take.
Take to help you sleep. Okay, so the real question is the other part of the issue, which is medications to help one fall asleep. There's a big problem there. If you take out the package insert on virtually any sleep medication, it'll say not for chronic use. So now they're used chronically, but it specifically says not for chronic use. Your Ambien, people take benzodiazepines definitely, and the reason for that is they deprive you of deep sleep. They induce sleep, but they decrease your deep sleep. So you actually, that's the situation where I was saying where you can sleep more hours, but you have a lower quality of sleep. You're not necessarily better off. Now, I don't use those medications at all myself. I'm not saying that they're horrible or they should never be used. There are times that somebody's in the hospital or short-term use, but that's not what we're talking about generally here. We're talking about more chronic problems. So conventional sleep medications, I basically don't use them. There's a couple things like Lunesta is approved for long-term use, the other less commonly used. A lot of times melatonin comes up, and melatonin products. I don't have a problem with them, but people have a misconception. They're not sedatives, and that's what people are kind of looking for, something to put me to sleep. Melatonin helps to get you on a sleep cycle, but it can work very well along with the sleep hygiene issues that I'm talking about. So it kind of facilitates the improvements with sleep hygiene and repetitive behavior and helps your body get back into sync a little better is the best way I can. But if you just do it and you do nothing else, melatonin is rarely helpful, other than the placebo effect. The placebo effect is you could do that with a sugar pill. If I gave you something and said, man, this is really going to help you sleep, if I gave it to everybody in the room, some of you would sleep really well, okay? And that's because you let go of your anxieties, your expectation was to sleep, and therefore you slept. So melatonin has that effect, plus there is validity to the point that it helps you get back into that sync a little bit better. So that's fine to look at. I use some other medications, non-conventional medications. Amitriptyline or Elavil is an old medication. It was the first antidepressant that was invented. I only mention that because people will look it up and say, wow, this is an antidepressant. Never used for depression anymore. They're far, far better antidepressants. But they found that when they had folks who had sleep problems and many types of pain issues, that sleep and pain got better. So now we use it for other problems. It's and there are some times that it's remarkable. Elavil is sedating. That's one of its side effects. So you take it at night. It helps with chronic muscular pain. It can be helpful for chronic neuropathic pain, and it can help relax the bladder, and it can help tighten the external sphincter. So people who have problems with voiding at night. So it's now that sounds really great, doesn't it? There's some downsides, and the downsides of Elavil is that it has a very, what we call a narrow therapeutic window. And when I look at medications, I always look at risk-benefit, cost-benefit, okay? And so there's definitely a downside to Elavil in terms of potential side effects. Folks with certain types of heart problems, arrhythmias and things, you have to be careful. Folks who are elderly have to be careful. But again, the point is being careful is different than not, not taking it all or not entertaining it. The real question in my mind is the benefit, does it outweigh that downside, okay? And so with Elavil, it has a narrow therapeutic window. The therapeutic window is the dosage where you have to see, when you're in that window, you have benefit but no side effects, none. Okay, I take that back, dry mouth. That's something that happens even at a low dose, but none of the major side effects. If you go down just a little bit, it doesn't help you. And if you go up higher, people typically have what I call a hangover effect. And they just kind of wake up and, what did I take last night? And the problem is that physicians who just kind of prescribe a certain dose, they don't know whether they're going to be under, because for some people their therapeutic window is up here and some people it's down here. So I take the time to educate every patient about this, and I say my recommendation is we go 25 milligrams, 50, 75, 100, 125. Now if 125 causes a hangover, what do? We don't stop it, we cut it back down. We found our therapeutic window. So I tell people, I want you to have that hangover for one morning. So there is a cost, there is a potential downside, but by doing this, you minimize any risk of significant side effects and potentially get all of those benefits I talked about. I use that for short-term use, and I use that when there are accompanying pain issues. So, for example, if I can help with the pain, get somebody into physical therapy, they're sleeping better, they're now in therapy, they're addressing their pain issues, and the goal is then, after a couple of months, to try and take away that, and then they're getting good sleep and getting good sleep habits. Now they don't need that anymore, as opposed to a long-term use. Elavil, E-L-A-V-I-L. Quite frankly, that brand is off the market. The longer name is amitriptyline, but that's easier to spell, so you can look that one up.
We're
okay.
past. Yep.
Coffee time. Thank you very much. And I'll be here if somebody has more questions. Thank you. Sure, absolutely.
Thank you.
Okay.